Those who are joining late, please help them out with the page numbers. Diet in Cancer, chapter 23, page number 482 in your dietetics textbook. Chapter 23, page number 482. So oncogenesis, okay, or oncogenes. Oncogenes are, onco means cancer, related to cancer, okay, and genes are the mutations that have took place, okay. A normal cell in which a cancer mutation has took place, okay. And what are the what do you think, based on your knowledge, are the reasons that could cause these mutations at cellular level? Cancer doesn't take at an external level, it takes place from a cellular level. Something changes in your DNA and that leads to cancer, okay. Can you give me some examples? Yes, free radicals. Mutation is the act of external factors. So I'm asking, what are the external factors that could cause mutation? Yes, UV rays, X-rays, stress, radiation, chemicals, certain kinds of food. And which is the virus that causes cancer? That is a cancer causing virus. Does anyone have an idea of it? What's the name of that virus that causes cancer? HPV, the full form of HPV. It's human papilloma virus. Human papilloma. Yes, it is human papilloma virus that causes cancer. HPV virus. Okay, there are vaccinations against that as well as a precautionary method. Okay. And sometimes certain mutations are inherited. Okay, these all are external factors. There are certain degree to which an individual can may have inherited the similar mutation from their parents. Okay, so maybe parents may have suffered from colon cancer, rectal cancer. Okay, the same mutated genes must have been inherited passed down to the future generations as well, and through genetic inheritance also mutated genes could travel. Okay, so based on these external factors, a mutation will take place at the genome. If you can see here, okay, a normal cell, inside the nucleus of a normal cell, you have your genome, that is your DNA, okay. And in a DNA, a small mutation has took place, okay. This is the mutation, the purple area is the mutation. So there is an alteration, okay. So now this DNA becomes an oncogene. This oncogene will manifest into the entire cell, because in whichever cell or in whichever cellular nucleus the mutation has took place, an oncogene has come up, okay. An oncogene has come up as a result of a mutation. That cell will turn into a cancerous cell, okay. So how does cancer spread? Okay, what could happen once it becomes an oncogenes? Okay, either of the three things will happen. The growth promoting oncogenes will be activated. Your body has a balance, okay. Your body has a natural yin and yang, okay. There is certain degree of defense mechanism like apoptosis, okay. Apoptosis is a programmed cell death that your body has, okay. It is normal cell death, okay. On a daily basis your body undergoes a lot of apoptosis, okay. What does the body does in apoptosis? It is able to kill and clear out the unwanted cells, or the cells that has the potential to become cancerous cells. So these cells will be killed, okay. They will undergo a series of phases which will lead to cell death. That is a programmed cell death, that is apoptosis, okay. And also your body has genes that are suppressor of cancer, okay. Cancer suppressor genes you already have in your body as a part of your defense system, okay. But along with these two factors, along with apoptosis taking place, and also along with cancer suppressing genes that you also have cancer promoting genes in your body. Okay, you also have cancer promoting genes in your body. So the cancer promoting genes will undergo activation. Okay, apoptosis will reduce. Okay, and there will be inactivation. If cancer promoting genes are active, what will happen to the cancer suppressing genes? That will become inactive. Okay, so the natural yin yang of your body is imbalanced. So that's how the body goes into a state of cancer. Okay, that's the pathophysiology of cancer. Is it clear to all? Is it clear to all? If you have any doubts, just check the flow chart which they have given on page number 482. 482. If you have the textbook, if you can see the image on 482, the flow chart, it is much more easier. Okay, so three things happens once the external factors have played into your nucleus. Mutation will take place. What is the mutation? A healthy DNA a part of the healthy DNA will become a oncogene. Okay, because genes together, they will come together and form a DNA, right? So one part of a healthy DNA, one part of the genes, a healthy gene will convert itself into oncogene. Oncogene means cancer causing gene. Okay, and from that oncogene, the entire cell, because of the presence of that oncogene in the DNA, which is now activated, the normal cell becomes a cancer cell. Okay. Next, coming to classification, depending on the location, we have different name. Okay, we have benign cancers as well as malignant. Okay, malignant is carcinomas, etc., which spreads quite fast. Benign are the tumors. Okay, they can be removed. Okay, using any ectomy surgeries, benign tumors can be removed. Okay, they have a very rare occurrences of coming all over again. But malignant tumors, they spread very fast. Okay, if the lymphatic vessels or your vascular system comes in contact with the cancer causing cells, okay, definitely at a very fast rate, the cancer will spread. Okay, so carcinoma, cancer of your epithelial cells, that is the cells which is present in the surface of your skin, your mouth, throat, breast, lungs. Okay, that's carcinoma. Sarcoma is the cancer of the bone, muscle, and connective tissue. Any connective tissue will be under sarcoma. Leukemia is the cancer of the blood forming organs, like your bone marrow, spleen. Okay. Lymphoma is the cancer of the infection fighting organs, like your lymph nodes in the lymphatic system. If they have this cancerous cells, if a mutation has undergone in the lymphatic nodes, it becomes lymphoma. If a mutation has took place in your bone marrow, okay, that leads to leukemia. In bones or muscles or connective tissue, that's a sarcoma. Okay, and anywhere in the epithelial cells, that's a carcinoma. Uterus cancer should come under carcinoma. You do not have lymph nodes there. Okay, and uterus is not a blood forming organ. Uterus is not a connective tissue. So usually the based on the sites, regions, the layers of the uterus affected, it should be carcinoma. Next, coming to the risk factors of getting cancer. First is your heredity. Different cancers have different risk factors. Okay, not that all the risk factors which we are going to discuss now is applicable to all types of cancer. Okay, different cancers have different kind of risk factors. So first is hereditary. As we have discussed in the pathophysiology, if you turn the page back on page number 482, if you see the pathophysiology, genetic mutation, genetically inherited mutation plays an important role in transmitting the cancer causing genes from one generation to another generation. Okay, so there is a strong hereditary tendency to pass on your cancer causing genes. And it is also seen that if grandparents from both the sides have suffered, have passed away through cancer, like any cancers, there are high chances that the parents may also go through some or the other kind of mutation. They have to keep an eye out for the caution symptoms. We'll discuss the caution symptoms later. Okay. So most cancers, they require not just one mutation, but at least two or more mutation before the cancer can manifest inside the body. Okay. And breast and ovarian cancers in females. Okay. If your first line of female relatives, first line of female relatives means your own sister, your own mother, your own grandmother. Okay. To whom you are directly related to by blood. Okay. For females. Okay. If your mother had suffered from breast cancer, there are high chances that the female of that mother, female daughters of that mother may also have the tendency to acquire breast cancer. Same applies for uterine cancer, ovarian cancer. The first line of female relatives, okay, it is very common. Most of the cancers are hereditary. Most of the cancers, as I mentioned earlier, hereditary doesn't mean it applies to all forms of cancer. Okay. Breast cancer, colon cancer, ovarian cancer, uterine cancer, these all have a high impact on heredity. Okay, from mothers to daughters, it is seen. If mothers are suffering from these types of cancer, daughters may suffer. And even if the elder sibling has a tendency to suffer from any form of this cancer, the younger sibling, the daughter, the younger sister may also have the same tendency. In cousins, it may vary. It may not be applicable to cousins, but grandmother, mother, sisters. Okay. Then we have the environmental factors like staffs who have been working in the radiology department. Okay, staffs who are working in the radiology department, people who are here from the hospital or who are from the medical field. What kind of precautions do you take as a staff in radiology department? Are you aware of it? The precautions you have to take as a staff if you are working in the radiology department of a hospital. Radiology department includes X-ray, MRI, CT, okay, mammography, ultrasonography. This all comes under the radiology department. You have to wear not a protective coat, it's a lead coat. Lead coat. You have to wear dosimeter. Okay, dosimeter is a band that is provided to all the staff in radiology. You have to submit the dosimeter to the BRAC, Baba Atomic Research Center in Mumbai. Okay, it has to be submitted every 2 months or 3 months, dosimeter, because dosimeter can accumulate the amount of radiation you have been exposed to. Okay, if any staff is found to have been exposed to a high degree of radiation, that staff will not be allowed to work in the radiology department for a few months. They will be kept in other department. And pregnant women, pregnant staff, pregnant nurses, pregnant technicians, pregnant radiologists, they are not allowed to work in the radiology department. Okay, so these are the protective policies which we use to safeguard the staff's health. Okay, from ionizing radiations like X-rays, gamma rays, etc. Then using certain chemical substances like benzenes, asbestos. Where have you heard about asbestos? Have you heard about asbestos? Asbestos is a very common name in chemistry. Have you ever heard about it? What is the use of asbestos? Asbestos. Asbestos is used for your insulation. See all the wirings, the roofings and all you see now. It has asbestos. Asbestos is a chemical, okay? It's a silicate chemical. It is used in the roofing, firing. It is fire resistant. The material is fire resistant, okay? So most of your industrial structure in the in engineering and all, asbestos is used, okay? Because it protects against fire, okay? It has a natural insulation, okay? But this chemical is notoriously known for causing cancer. Okay, asbestosis is an occupational hazard. Okay, it's a disease that comes under the occupational hazard. The workers who work in asbestos manufacturing companies, or from the ores where asbestos is been extracted, okay, they suffer from this condition like asbestosis, etc. It's a respiratory condition as well as cancer causing condition, okay, notoriously known for causing cancers. Benzene, tobacco in India, okay, tobacco, use of tobacco, consuming pan with tobacco, okay, these all come under the chemical substances that are supposed to cause cancer. Next, coming to dietary factors. Can you give some examples here? What you may have heard about how diet can lead to cancer? Yeah, intake of meat has been positively associated with increased risk of cancer, specifically your colon cancer. Okay, increased consumption of meat, especially red meat and all. Okay, and also see in India it's very rarely seen, but in countries like USA and European countries, most of the food is canned food. Have you noticed that? Even if they have to buy tomatoes, they get canned tomatoes, beans, chickpeas. Okay, these things are canned. Have you noticed that? But in India, it is very rarely used. You will especially use fresh tomatoes or fresh chickpeas. You will not go for canned items. But in most of the cold countries, okay, where the temperatures fall very low, okay, they can't preserve the fresh vegetables like how it can be preserved in tropical countries. Okay, so they rely a lot on canned and packaged food items. Okay, so what happens is that certain microorganisms over a period of time can grow in this canned and packaged food. That could also lead to cancer. Okay. High intake of certain fish sauce. Fish sauce is not culturally used in India, but it is used in countries like Philippines and Korean countries. Okay. South Asian, certain South Asian Eastern countries, fish sauce is used. Okay, so that also, yeah, sometimes using aluminum foils, putting hot piping food into aluminum foil could lead to cancer. Storing hot food in plastic dabbas and all plastic containers, that could lead to cancer. The way how you cook, you store the food, okay, that has a direct carcinogenic effect. And cooking meat, if you, even if you're a meat eater or a non-vegetarian, if you cook your meat at very high temperatures, okay, like too much of fried and deep fried meat, okay, that has a risk of cancer. Then sugars, having too much of starch in your diet, okay, and fat, if you're having too much of animal fat in your diet through butter, ghee, okay, or even just having fatty meats in your meal, that could also lead to cancer. Increased meat intake has been positively associated with showing increase in proportionally increase the risk of colon cancer. And based on your vitamins and minerals, when you have low carotenoid levels, there is a high chance of getting lung cancer. Carotenoid levels, that is vitamin A. Okay. Low dietary intake of vitamin C has shown a relationship with oropharyngeal cancer, stomach cancer, esophageal cancer. If your diet has low vitamin E, okay, that can lead to lung, cervical cancer, or colorectal cancer. And alcohol has a very casual role. Okay, it's not that alcohol will lead to compulsorily will lead to cancers. Okay, moderate consumption, mild to moderate consumption is not harmful. But yeah, overconsumption and being an alcoholic, it could lead to cirrhosis of liver. Okay, Usually the liver mutations are very highly associated with alcoholism. Okay, mild to moderate consumption is completely fine, but if you're an addict, okay, there is a issue with alcoholism, then the liver, there could be mutation in the liver. It could lead to cirrhosis, or cirrhosis can lead to cancer if gone untreated, or in final stages of cirrhosis. Then certain nitrates in the food, like if you have a habit of eating too much of pickled items, okay, like when you are packaging and pickling and packaging the food items, okay, it releases a lot of sodium and potassium nitrates into the food that could lead to cancer. And certain toxins like aflatoxins, that's a fungi which grows on cereals and groundnuts, that can lead to liver cancer. Lung cancer patients can be given beta carotene, because we have just now read low levels of beta carotene, low serum carotene levels have been seen in lung cancer patients. So there is kind of a positive correlation between low carotene levels and lung cancer. So the lung cancer patients will be given beta carotene supplements. So that's about the dietary factors. Next, coming to estrogen. So estrogens, like too much of estrogen in your body, okay, if your body is making too much of estrogen, what kind of cancers do you expect? So estrogens are artificially supplied also, like for HRT therapy. Have you heard about it? Hormonal replacement therapy. HRT, hormonal replacement therapy. Have you heard about it? HRT therapy. Yeah, it is the common symptoms which you will see is uterus and breast cancer. But what happens is that to give relief to postmenopausal women, okay, once you attain menopause, if you can't bear the signs and symptoms of menopause, menopausal women are given HRT therapy, that is hormonal replacement therapy. HRT is not just limited to postmenopausal women; it is also given to women for whom uterus has been removed because of some complications or because of cancer, okay, or as a if the uterus has undergone any injury or trauma, uterus has been removed. Even in such cases, HRT therapy is given. In certain cases where ovaries has been removed, okay, in that case also HRT therapies are given. Okay, so it's not just limited to postmenopausal women. So but what is the concern here is that when you give HRT therapy, hormonal replacement therapy, you introduce a lot of estrogen into their body, and that estrogen may lead to breast and ovarian cancer. Okay, also uterus cancer. Uterus cancer is endometrial cancer, that roughly translates to uterus cancer. Okay, that's the role of estrogen. Then certain metabolic syndromes, like your like colorectal pancreatic cancer in males and breast cancers in females. Okay, there are high chance that you may have some inborn errors of metabolism, or you are not able to metabolize your macronutrients properly. The metabolites that remains in your body, that becomes toxic, and these toxins will cause some mutation in your genes. Okay, because the metabolites are supposed to be removed from your body due to some external reasons. Apart from cancer, the metabolites remain stagnant in your body. It becomes toxic to your body, causes mutation, and it will lead to cancer. Usually it is the colorectal cancer and breast cancer colorectal cancer in men and breast cancer in women. Stress and other viruses like human papilloma virus, Epstein-Barr virus, they are also considered oncogenic. You will definitely have the signs and symptoms of intolerance. Okay, if the body is not able to metabolize certain nutrients, you will see the signs and symptoms of intolerance. And when you do a food sensitivity test, okay, when we will discuss about the chapter on food sensitivity and food intolerance, okay, there's a chapter on food sensitivity. When we will discuss that chapter, you will come to know what kind of test we have, okay, to correct our to diagnose ourselves from metabolic syndromes. Okay, there's an entire chapter on that. We'll discuss that later. And stress that can cause damage to the thymus gland. And if the thymus glands are damaged, that will affect your immune system. And it also has hormonal effects. So that would lead to cancer. Usually the cancer through your of your adrenal cortex, of your kidneys. Okay. Then age, the incidence of getting cancer is higher among people who are above 65 years of age as compared to people who are in the midlife, that is 40 to 64. Okay, once you cross 64, the chance of getting cancer is 6 times. So with age, the risk of getting cancer increases. Then physical activity, those who have a regular vigorous physical activity with endurance, okay, they have a lowest risk of cancers, not just colon cancer, any form of cancer. People who have a sedentary lifestyle, okay, inactive lifestyle, have a higher risk. Then immune factors. So sometimes your healthy immune system can recognize what is foreign, okay, and it can destroy it. But sometimes, as mentioned earlier in the pathophysiology, if your immune system is suppressed, okay, the cancer sensing genes are suppressed. It will not be triggered if there is a mutation. Usually, whenever there is a mutation, the cancer sensing genes will get triggered and it will go and destroy that cell through apoptosis. Okay, but when there's a suppression of cancer inhibiting cells, it leads to cancer formation. So that is how immune factors may play here. Environmental factors, ionizing radiation, which we have discussed, that is X-rays, gamma rays, ultraviolet rays, chemical substances like benzenes, asbestos, cigarette smoke, tobacco, viruses, human papilloma virus, Epstein-Barr virus, stress, dietary factors, that is meat, consuming too much of meat, red meat especially, energy balance. If you are obese, if a person is obese, their BMI has been increasing over a period of time. From overweight, it has been increasing over a period of time. That is also a risk of getting cancer. Sugars, too much of starch in the diet. Fat, too much of animal fat in the diet. Protein, again, increased meat intake. If you source most of your protein from you source most of your protein from non-vegetarian diet only, and you do not recommend plant-based protein in your diet, that could lead to cancer. You should have a healthy combination of both. Vitamins and minerals, which we have discussed: low carotenoid levels, that is beta carotene, low vitamin C, low vitamin E. Alcohols, liver cancer. It is directly proportional, alcoholism and liver cancer. Nitrates, too much of pickled items, okay, salty pickled items kept for a pretty long time, that will release sodium nitrates and potassium nitrates, that is cancer causing. Aflatoxin, which is seen a fungi, it's released by a fungi which grows on cereals and groundnuts. Beta carotene supplement is given to people who suffer from alcoholism, also people who are undergoing lung cancer treatment. So is it clear, all the risk factors? Is the risk factors clear to all? So next, coming to the symptoms. So this is the caution symptoms. Okay, you can take a screenshot of it. This could be helpful to all. Caution is the mnemonic which we are using to remember all these symptoms. Okay. So C stands for change in the bowel or bladder habits. Okay, that is a common sign of colorectal cancer. Okay, first is change in your bowel and bladder habits. The usual timing of eliminating and excreting the waste from your body, that changes. The consistency changes. Sometimes there could be bleeding as well. You will notice bleeding, blood stains, mucus stains, etc. Okay. Next, A stands for a sore that does not heal. Okay. It could be somewhere. Usually, it is the area which is afflicted by cancer, and most commonly it is seen in people who suffer from oropharyngeal cancer, oral cancers, etc. You will see that there will be a small wound, a sore, an ulcer kind of formation. Okay, on their skin, somewhere on their skin, mouth, etc. And this is it keeps on bleeding even after like few days, when it is supposed to clot and heal up and form into scab. Okay, it's not forming into that, it's still open, it keeps on bleeding. Okay. Then U stands for unusual bleeding or discharge from the bladder, vagina, okay, rectum. That could mean either prostate, cervical, or colorectal cancer. If there is an unusual bleeding, that bleeding in between your month, okay, it's not, you will know that it's not the regular menstrual bleeding. Okay, your menstruation days have gone, and within a week after menstruation, you are getting bleeding again and again. Okay, with pain. Usually, it comes inhibits pain, or sometimes it may be a painless bleeding. That may be an indicator of cervical cancer. Okay. And bleeding through your urine, there is blood in the urine for men. Okay. Or while passing your excreta from the rectum, there is a bleeding, that could be prostate or colorectal cancer. And T stands for thickening or lump in the breast or anywhere else, because thickening will definitely happen because the cell differentiation, that is, one cell will convert into two will divide into four will divide into eight. That is cell differentiation. So cell differentiation takes place at a very rapid pace when it is a cancerous cell. When it is a cancerous cells will differentiate at a very rapid phase. So that area will become thicker. Okay. And sometimes if it is a lump is something is an under differentiated, non well differentiated mass of cells. Okay. So that will be present in the breast as a form of benign breast tumor or cancer, or anywhere else there is a thickening or lump that you can feel, especially near your lymph nodes, like under your if you palpate your underarms, you palpate your groin region. Okay, these you palpate under your jaw. Okay, just below your ears and all. These are the areas where it is rich with lymph nodes. These areas have a lot of lymph nodes. Okay, if you find any movable mass or lump here, that means it could be a sign of cancer. And in men, when you can do self test of your testes. Okay, if you find any unnatural lump there, get it checked. I stands for indigestion or dysphagia. Dysphagia means difficulty in swallowing. Okay, difficulty in swallowing, that is dysphagia. Indigestion, it could be in the form of diarrhea, continuous diarrhea, unexplained diarrhea, non-infective diarrhea. You do not have any fever. Okay, but still the diarrhea is persisting, so that you know it's not because of infection. Okay. O stands for obvious change in a wart or mole, natural mole which you may have had since your birth. Okay, there is some change in that. Okay, that is a common sign of skin cancer. It may like the edges of your mole, or the edges of the wart which you have on your body, the edges becomes roughened. Okay, that could be a sign of skin cancer. And skin cancer is very rare in Indian population. It is commonly seen in Caucasians and in the continent of Australia. Okay, they have the highest cases of skin cancer. The N stands for nagging cough or hoarseness, cough that can last more than a month. Okay, but the cough does not come with fever. Okay, if there is a fever, weight loss, okay, and you have cough for more than 4 months, fever, severe weight loss, uh, cough for more than 4 months, and there is blood in the sputum, what could it be? What disease could it be? Sometimes there would be chest pain also at night. It's TB, okay, because tuberculosis is caused because of an infection. So it's an infection, it's a bacilli that is causing, okay. Here it's not because of an infection, so you will not see fever. Hoarseness of your sound, okay, sound changes, that is hoarseness of your sound. So these are the caution symptoms that you have to keep an eye out for. Is it clear to all? Australia has more cases because see, Australia is a continent which requires a healthy dose of sunlight. Okay, Australia as a continent was not inhabited by Caucasians. Caucasians means the white people. Okay, just putting it across loosely. So Caucasians are not were not the native to Australia. They came and colonized Australia, just like how the British came and colonized India. The same way the British and other European colonizers, they went and colonized the land of Australia. Okay, the natives of Australia, if you see, they are they are very similar to the Africans, okay, the Negro Africans, okay, they are very similar to the Negro Africans, the Australian native people. They are dark skinned, okay, dark to brown skinned people. So Caucasians, when Caucasians have a very low melanin count naturally on their skin, and melanin is also a protective chemical that protects your skin from skin cancer and sunburn, okay, which we Indians as a brown skinned people, and even in Africans, okay, dark skinned people, black people, it is quite rich, okay, we are enriched with melanin, so that gives us a natural protection against skin cancer. Melanin is very less in Caucasians, that's the reason why they are this fair. Okay, so Australia is very close to the equators or equator also, okay, and yeah, the ozone layer just above the Australia is also depleted. The coral, that's all global warming, okay, coral reefs are getting depleted, that is all global warming cases. But this is the main reason why we have a lot of cases in Australia. The people who came and colonized Australia are not physically made to stay there, okay, they are not physically made to stay in the continent of Australia. Okay, that's the reason why skin cancer is much prevalent there, because now if you see the Australian population, okay, the white Caucasians are higher and the native Australians are a minority. Okay, next, coming to general and systemic reactions. Abnormalities in metabolism. You could suffer from extreme weight loss and weakness, okay, because of glucose metabolism. Your body is not metabolizing glucose for energy. Uh, they cannot produce glucose efficiently, okay, cancer patient, even whatever food you give them, they cannot produce glucose efficiently from carbohydrates. So that's why what happens is that their body will feed off for carbohydrates on their own tissues or on their own muscles. For carbohydrates and protein, when the body requires it, it feeds off from their own body. So that's why you see severe weight loss in cancer patients. And sometimes glucose intolerance is also seen in cancer patients due to increased insulin resistance. When insulin is not working properly, the cells are rejecting insulin, so the blood glucose level will not come down. So they cannot tolerate glucose in their diet. Next is anorexia. Usually anorexia in cancer patients is associated with dysphagia. Dysphagia we have just now discussed. It is difficulty in swallowing. Okay, swallowing the food is very difficult. Is very difficult for cancer patients, so they deprive themselves from having food. Second is when a cancer patient is undergoing chemotherapy or any radiation therapy. Okay, they are not fit to have a lot of food. Just give me a minute. Yeah, am I audible now? Okay, so anorexia, it's because of dysphagia as well as the treatment that the cancer patients are undergoing, that they will deprive themselves of having food. Sometimes even if they have food, they can't keep it in their stomach. They just vomit it off. Okay, and it leads to cancer cachexia. Okay, cancer cachexia is a clinical stage in which you experience severe weight loss just because of cancer and its symptoms. Okay, then wasting, that is muscle wasting. And usually what happens is that if there's a tumor in the body, if the tumor wants to grow, okay, the tumor wants to grow, the tumor is still growing. Okay, it is growing at the expense of the host body. The host, that is the patient here, is not eating. Okay, is depriving themselves of nutrition. Okay, so what the tumor will do, the tumor will take the protein and the glucose, whatever is required for its growth, from its adjacent cells, from its adjacent muscles, to grow by itself. Okay, so that is how the tumor grows in the body, and it grows at the expense of the host body. Okay, so that's why how it leads to muscle wasting, or the wasting in general, not just the muscular level but even at cellular level. The immunoglobulins, the immunity, everything is taken up by the cancer cells. Then we see malabsorption, usually vitamin B12 deficiency, that is not absorbed by the body during cancer, and fat is not absorbed by the body. So what happens is that whatever fat is remaining in the body, that will be completely dumped by the excretory system. Okay, so that leads to steatoria. Then we have the fluid electrolyte imbalances. It's usually because of continuous diarrhea, steatoria, and continuous vomiting. That is a side effect of the chemotherapy, drugs, etc. You see fluid electrolyte imbalance in a cancer patient. Anemia, along with iron, is already a tricky mineral to be absorbed. We'll see that later in next week's class. We'll discuss on micronutrient iron. Okay, so iron has a lots of conditions that applies for its absorption. So since already the patient's internal system is weakened, okay, there will be a malabsorption of iron. But along with iron, folic acid, vitamin B12, vitamin C, which all is required for iron absorption and management in the body, they all will not be absorbed properly. So that leads to anemia. Taste and appetite changes. There are very few food items that the cancer patient can eat and keep it in the tummy. Otherwise, rest of the all hard food will be vomited out. Then learned food aversions. Sometimes what happens is that it even in a normal individual, a healthy individual, this thing happen. Sometimes you may have overeaten a particular kind of food. Okay, and it gave you diarrhea and vomiting. It led to severe vomiting and diarrhea. Will you have the tendency to eat the same food later on in your life? You can answer in the chat box. So this is an example of learned food aversion. Okay, any food item, the food may not have been the causative agent, but it led to severe symptoms in your body, severe side effects in your body. You will have a natural aversion towards that kind of food. That is seen in cancer patients. Then hypercalcemia. It's the most common metabolic complication, as I have mentioned earlier. The body is not able to metabolize certain nutrients, and calcium is one of that. Body, even if through diet you're giving them calcium, they are not able to absorb it or metabolize it and deposit it wherever it is required. So there will be too much of calcium ions just circulating in the blood. That's how we get hypercalcemia in cancer. Then osteomalacia, since the calcium ions that are supposed to be mineralized, that are supposed to mineralize the bones, they're not functional in that particular department. All the calcium ions are in the blood. It's not going and mineralizing the bones. So what happens here? The bones becomes soft. Okay, osteomalacia is softening of the bones. Is all the general systemic reactions clear to all? Is this topic clear to all? This slide. Now coming to the nutritional problems in cancer. First is this cancer in which you have given surgery as a treatment. Surgery was the only treatment option. So if you can imagine a patient who has oropharyngeal cancer, oral cancer, pharyngeal cancer, you must have seen in movie theaters before the movie starts. Okay, they may show images, brutal images of a person who may have undergone the removal of their jaw, okay, removal of a part of their tongue or cheeks. Okay, what kind of nutritional problems may this person suffer from? Just imagine watching that particular clip which they show in the movie theaters. A person with no jaw, or a part of the mouth has been removed, part of the tongue has been removed, glossectomy, etc. They cannot eat, they have to be put on NG tube feeding. Okay, chewing and swallowing becomes impossible for them. They will be put on nasogastric tube feeding. Okay, or sometimes in some cases directly they will be put on any parenteral nutrition. Okay, so these are the nutritional complications which comes in surgical treatment. Sometimes in gastrectomy, you remove a part of a stomach. In case of stomach cancer, you remove a part of the stomach, and you get a dumping problem. Okay, dumping problem means the entire food that you have just swallowed, okay, before getting properly mixed in the stomach juices, as it is, it will go and dump itself into the small intestine, and the small intestine will be overloaded and overworked to digest these food particles. That is the dumping problems. Then pancreectomy, if you remove a part of pancreas to prevent the spread of pancreatic cancers, okay, that would lead to no secretion of digestive enzymes, because pancreas, they don't just secrete insulin and glucagon, they also secrete digestive enzymes that help in digestion. So the digestion and malabsorption will follow after a surgical treatment. Okay, so which part of the body you have removed, specifically from the GI tract, okay, from the mouth region to your rectal region, whichever part of the body you have removed, it will have some or the other implication in nutrition, okay, and digestion. Next, coming to problems in radiotherapy. So Over radiation or exposure to radiation will usually leads to mucositis, especially if it is oropharyngeal cancer. Mucositis means if you touch the internal area of your mouth, okay, the inside of your cheeks, okay, that area, etc., will undergo inflammation. That is mucositis. Then dysphagia, again, difficulty in swallowing. When you try to swallow a food, it is very painful for you to swallow. For example, if you have tonsillitis, most of us may have suffered from tonsillitis any part of your in any part of your life. Okay, so while having tonsillitis, even while drinking water, you know how difficult it is, how painful it is to even drink water. Okay, so that is also that can also be called as dysphagia, difficulty in swallowing. Either it is painful or there could be something that is choking you. Okay, loss of taste sensation. If you do not feel the taste and texture of the food that you're consuming, that would lead to anorexia, nausea, diarrhea. Okay, abdominal radiation, too much of radiation in the abdominal region, that will lead to damaging the intestinal mucosal lining. And if the intestinal mucosal lining is damaged, again it will impact the way how food is digested and absorbed in the intestine. There could be inflammation, fibrosis, stenosis. Stenosis means narrowing. Okay, the lumen of the entire intestine that may become smaller and smaller. Next, coming to the problems related to chemotherapy. So chemotherapy, I guess most of us have an idea what chemotherapy will follow up with. Okay, chemotherapy is not an easy phase for anyone. Okay, can you just give me some examples if you may have had relatives or you know people who are undergoing chemotherapy or in the past they have undergone? What kind of signs, symptoms, and side effects have you seen? Does chemotherapy drugs have an effect on nutrition, the way how nutrients will be absorbed from the intestine? Yeah, vomiting, nausea, loss of appetite, weight loss, weakness is true. Having chemotherapy, if you are on a chemotherapy drug, will these drugs have an effect on your nutritional absorption? It will. Okay, the drugs used in chemotherapy and also like in TB, it will inhibit the absorption of certain nutrients. Okay, that would lead to deficiencies. Okay, so malnutrition can be seen here because of the way how chemotherapy drugs interacts with food. Also, the side effects that the chemotherapy drugs will bring into one's life. Okay, it leads to malnutrition. Next, coming to the nutritional requirements. So energy, 2000 kilocalories for adult patient is a target here, but it is very near to impossible to keep this target up. Okay, protein requirements is 80 to 100 grams. Have you noticed something that is abnormal here, and why this high amount of protein? For an adult person who has a sedentary lifestyle, 60 gram of protein, 60 to 70 gram of protein is more than enough. Okay. Yes, since the body is under catabolism, muscle wasting, cancer cachexia is going on. Tumor cells are feeding on the body's own protein reserves. Tumor cells are feeding on the body's own protein reserves to grow and differentiate, and depriving the healthy cells of the protein. Okay, to counteract that, the protein requirements is high. All the micronutrients supplements are recommended because there is a high chance of malabsorption. Also, the drugs that chemotherapy drugs or radiation that may interfere with the nutrition absorption. Okay, so micronutrients supplements are recommended. Do not depend on the diet to give to supplement the micronutrient, go for supplements directly. Fluid, avoid dehydration, minimum 2 liters of water. Do not keep the cancer patient dehydrated. And just a snapshot of how you can arrange the food. Okay, half of the plate, whatever meal you're giving, half of the plate should have fresh fruits and vegetables. 1/4 of the plate can have protein. Okay, non-vegetarian or vegetarian based, vegetable based, plant based protein can be given, and only 1/4 should be grains or cereals. Next, coming to the dietary management. So when you see a cancer patient suffering from nausea or vomiting, okay, what ideas do you have to prevent it, or what ideas do you have to combat nausea and vomiting? Not just in cancer patients, but generally. Yeah, light diet, soft diet. Semi-solid will also do. ORS to combat electrolyte loss. But the negative, the con of having semi-solid or liquid diet is that it will be easily vomited again. Okay, so what we are focusing here is whatever food you are providing the patient, it has to be dry food. Okay, for example, glucose biscuits, dry crackers. Okay, glucose biscuits, anything that is dry. Can you give some food examples from Indian cuisines that is pretty dry in consistency, which has a very less water content? Yes, rotis, parathas, toast, rusk. Yes, rusk. Oats, when you make it into a porridge, etc., it becomes semi-solid. Again, oats will be easily vomited out. Yes, dry poha. Dry poha is a dry food. Upma, if it is made on the drier side, it's a dry food. Khakra, which is very common to Gujaratis. Khakras. Idlis have water content. It is a steamed food, na? Anything that is steam cooked, it has higher water content. Any form of biscuits, okay? Focus on glucose biscuits like Parle G's, etc. So give these kind of dry biscuits, dry food for people who are suffering from severe cases of nausea and vomiting, because the dry food will stay in the stomach. Okay. And if you are giving beverages, they have to sip it slowly. They should not gulp it down. Do not encourage them to gulp the beverage down. It has to be sipped slowly. Okay. You can also provide straws for this purpose. Next, coming to dry mouth. Dry mouth is a symptom of dehydration. So you have to take steps to prevent dehydration or counteract dehydration. Okay, so drink at least 2 liters of liquid daily. High calorie beverages are preferable here. Okay, broth can be used, non-vegetarian or vegetarian broth can be used instead of meals. That will also give some nutritional value to the patient. And in severe cases of, coconut water can also be given. In severe cases, artificial saliva is given. Okay, you can search about artificial saliva on Google. You will see the method how it is given. Okay, only in severe cases of dry mouth it is recommended. Otherwise, dietary management is more than enough. Next, coming to taste alteration. So in taste alteration, they may have lost a sense of taste, etc. So you have to try experimenting here. A lot of trial and error has to be done here. What they may like, you may have to change the cuisine. Okay, you may have to add more seasoning or something like that. Experiment with your flavors and seasoning. For example, if you're used to cooking with mustard oil, change it for a bit. Use olive oil or groundnut oil, gingerly seed oil. Okay, whatever. Just change the oil and see if the new seasoning suits the patient or not. Okay, so try experimenting to combat taste alterations. That loss of appetite, small and frequent meals, high calorie and high protein diet, even if the quantity is small. Okay, if the quantity is small but the calorie is high, the protein is high. For example, milk. Okay, giving them milk, eggs. Okay, eggs with bread omelette or something like that. That is a high calorie food, but the quantity is very less. It has a high amount of protein and calories. The quantity wise, it is quite less. Okay, protein bars can be given here. Energy bars, protein bars can be given. Protein bars and energy bars are also dry in consistency, so they will also prevent nausea and vomiting. Okay. Sore mouth and sore throat, non-acid foods. Okay. Alkaline, so basic food has to be given. Blended and liquefied food that they can swallow easily without chewing, because with sore mouth and sore throat, chewing and swallowing is difficult. So anything that you can gulp down, okay, that is easier. With swallowing for problems, avoid too much of seasoned and spicy food. Liquid feeding, soft diet, liquid diet, clear fluid diet. Stick to these alternatives. And tube feeding is recommended only under medical prescription. Okay, NG tube feeding is recommended only under medical precautions. See, only if the patient is suffering from severe nausea and vomiting, we will stick to dry food. Okay, all the dietary management which we are discussing here, all the signs and symptoms, side effects which we are discussing here, it's not necessarily seen in the patient altogether. Okay, so you just have to prioritize what kind of symptom is too much in your patient and make a diet plan according to that. Okay, all the symptoms which we are discussing here, it's not necessary that all of these will be present in a single patient. Okay, every patient may have manifestations in different form. Then early satiety, small, that is to make them feel full sooner. Okay, so even with a small quantity of food, small amount of food, just one chapati or half a chapati, if they eat it, they feel full with that. Okay, they do not want to eat anything more. But if you see the caloric value, we our target is 2000 kilocalories per day. Okay, even though it is impossible to reach that, but if the patient sticks to just half a chapati or one chapati in a meal, it is impossible to reach that particular target. They feel satiated quite soon, just with small amount of food. 2 to 3 morsels of rice with some curry can make them feel completely full. So how can you overcome that? Small frequent meals, adding snacks more into their diet. So making snacks that are healthy, okay, but also has some nutritional value to it. Chewing food well while eating slowly, that makes sure that they will not feel full sooner. Okay, avoiding food that are highly active in fat, because fat will induce early satiety. And whatever water or any beverage, if you want to give them, give it 30 to 60 minutes before you feed them. Otherwise, if you give them immediately before they start eating, they will feel full sooner. Okay, so keep a half an hour or 1 hour gap between giving them water or any beverage, and then give them the solid food. So this entire management is given on page number 494, table 23.3. Okay, in detail it is given. See, like protein laddus, protein bars, snack bars. Okay, These all are snacks which are healthy snacks. Baked peanuts which are air fried. Okay, chickpeas that are air fried, or just sauteed in a little bit of oil and with masalas. Okay, these all are healthy snacks. So next, coming to nutritional supplements. The supplements which are commercially available are useful. As we have mentioned earlier, we do recommend nutritional supplements for cancer patients, because if you depend on just on diet for the nutritional requirement, it would not suffice. Okay, so commercially available supplements are useful here. Whey protein is also useful here because our protein requirement is high, but the appetite in the cancer patient is pretty low. Okay, so whey protein can help you meet in a middle ground. Okay, so they can definitely use whey protein if they are tolerable to it. Okay, then these are the mushrooms which are offered to the cancer patients. They are supposed to be nutritious, okay, but they also, to an extent, help preventing the further spread of cancer. Okay, but it has to be, yeah, pea protein can also be taken. It is plant-based protein, so it can be taken. So you have reishi mushroom. If you see the red mushroom here, that is the reishi mushroom. Then there's the maitake mushroom. This is this one which almost looks like a human brain. Okay, that is the maitake mushroom. And button mushrooms. Button mushrooms are commonly used in our Indian kitchens. Okay, that is available in the market as well. Button mushrooms. Okay, so these mushrooms are supposed to boost your immunity, and via immunity, they are able to activate the cancer suppressing genes as well. Okay, but for the research is required. We have very little study to support it, but these mushrooms are supposed to take care of the health of cancer patient. It will not cure cancer, okay, but it can help in symptomatic management to an extent. So these are the cancer preventing food. If you have a family history of cancer from both the sides, from maternal as well as the paternal side, okay, you have to invest your nutrition into these categories. Okay, vitamin C, E, and K. More of vitamin C, E, and K from fresh fruits and vegetables, cereals, seed oils, seed-based oils. You can get vitamin E. Vitamin K is available in plenty of your green leafy vegetables, dark ones. Okay. Mineral selenium. In which food do you find selenium? Any guesses? Any guesses which food? Previous past students also. All your seafood. Okay, remember this. All the seafood. And if you're a vegetarian, there is seaweed also. Okay, the seaweed is available. That is the vegetable source of seafood. Okay, yeah, Brazilian nuts, eggs, most of your nuts, seeds, and cereals, spinach. Okay, cashews, all the seafood, Brazil nuts, seeds, all the forms of, most of the seeds have selenium. Seeds, sunflower seeds, pumpkin seeds, melon seeds. Okay, they have selenium. Then coming to carotenoids, all your yellow and orange fruits and vegetables, they have carotenoids, beta carotene, lutein, lycopene is present in tomatoes. Okay. Then phytochemicals, flavonoids. Where have you heard this? Flavonoids. Flavonoids is an antioxidant. It is present in teas. Okay. Green tea, black tea, all the teas have flavonoids. Okay. Naturally present in the tea plant. So these are the phytochemicals. Apart from flavonoids, what are the other phytochemicals? You can take a screenshot of this. Even on page number 23.5, table number 23.5, on page number 498, they have a small table regarding this. The ones you see on the left side, the left column, that's the name of the phytochemicals. The sources of phytochemicals are on the right side. You can take a screenshot of it. It can be useful later. Only few phytochemicals have been mentioned on the textbook. This list is exhaustive. The one which is on the slide is a much more exhaustive list. Shall I change the slide? You do not have to memorize the names, okay? No need to memorize the names of the phytochemicals. Questions won't come like that. Next, coming to prebiotics and probiotics. Prebiotics are the food for the gut bacteria. Okay, probiotics means what? It is the good bacteria which is present naturally in your stomach, in your intestine, okay, in your GI tract. You naturally have good bacteria. That is called probiotics. Okay, prebiotics is the food that you can eat so that these good bacteria can thrive better in your intestines as well as your GI tract. Okay, so prebiotics, some examples are there. Asparagus. Asparagus is not commonly used in Indian cuisine. Okay, wheat bran or wheat flour, garlic, banana. Okay, they are good prebiotic food. Okay, they are good for your gut bacteria. Okay, then directly you can ingest gut bacteria as it is through your yogurt, probiotic milk, sour cream, kefir. Okay, also Yakult that is available in the market. Yakult, have you heard about Yakult, the probiotic drink? It is fermented milk. So when you are having Yakult, make sure you keep a 5 days break. Okay, do not consume Yakult for the entire 30 days or 31 days of the month. Okay, give your stomach a break of at least a week. Okay, anytime in between the month, that entire 1 week or 5 days, don't drink Yakult. Okay, the remaining days you can continue it. Okay, so keep a 5 to 1 week break if you are on Yakult. Okay. So the probiotics are considered to have potential of being a carcinogenic agents. Okay, the potentially carcinogenic agents which are found in food. Okay, if you have good gut bacteria, they can compact these carcinogenic agents. So that's how these bioactivations, like it can lead to your system having a good immunity against cancer. Okay, that's the reason why we are focusing on probiotics. You have to take a break because you have to allow your stomach to retain its natural growth. Otherwise, if you are overdoing with the Yakult, see, remember you are ingesting live bacteria. Okay, you are ingesting live bacteria, and it would lead to if too much of live bacteria is ingested, even though it is good bacteria, it can still cause internal infection. Okay, to prevent that, it's better to have a 1 week break or 5 days break while consuming Yakult. Yeah, even though it has preservatives, it is made in such a way that it is consumed daily. Okay, it is made in such a way that the preservatives are not that harmful. Okay, you can still have that. Okay, it's Yakult is made in such a way that the preservatives are fit for daily consumption. It's ideal to consume this probiotics and prebiotics when the gut is empty. Okay, first thing in the morning. If a person is having IBS, the doctor will prescribe probiotic. Okay, so if the doctor has already prescribed a probiotic, no need to take Yakult. Okay, just follow the doctor's prescription. Those who are suffering from IBS, the dietary concerns will be given by doctor. The doctor will prescribe the lactobacilli through probiotic tablets. Okay, you just have to consume that. No need to consume Yakult. That okay. After you have managed the symptoms of IBS, after consulting your doctor, you can ask them if you can continue Yakult or not. Based on the recommendation only, you move forward. About thyroid medicine, please confirm with your endocrinologist. Whoever has prescribed you the thyroid medicine, please confirm with that where you have to place the probiotics or prebiotics, because we do not know how it may interfere with the medication you have been prescribed. Okay. Kefir is usually used in Middle Eastern cuisine. Kefir is a kind of curd, sweetened curd or something like that. It is used in Middle Eastern cuisine. Next, coming to resistant starch. Okay, there is a like if you are used to taking a lot of resistant starch in your diet, it lowers your risk of colon cancer. Studies have proven that. Okay, resistant starch means from the name itself, these starch are very difficult to break. It's very difficult for your digestive enzymes, your gastric juices to break it down and metabolize, because starch has to break down. Starch is a carbohydrate. It has to break down to form glucose, so that glucose can be absorbed by the intestine. Intestine cannot absorb starch as it is. So resistant starch is a kind of carbohydrate which is very difficult to be broken down. Okay, just based on your digestive enzymes and GI gastric juices. Okay. So these are the sources of resistant starches which is naturally available in food: kidney beans, brown rice, green bananas, lentils like your tur dal, etc. Muesli cereals, oats, potatoes. Okay, they are good sources of resistant starch. So they stay in your intestine for a pretty long time. They slowly release the glucose. They get metabolized pretty slowly. They slowly release the glucose, and they act as a complex carbohydrate. They will not shoot up your blood glucose level. Okay, so the body will not go into a stage of insulin resistance over a period of time. Okay, so that's how resistant starch can prevent colon cancer. Next, coming to dietary fiber, just like resistant starch, it protects against the colon cancer, also gastrointestinal diseases. It controls high cholesterol, because if there is too much of fiber in your diet, fat will not be absorbed by the intestine. If the fat is not absorbed by the intestine, there will be very less fat in your blood circulation. Okay, so that's how dietary fiber controls the high cholesterol. It reduces inflammation. It aids in weight loss. We know increasing the fiber, it will lead to too much of excretion of food. Okay, less absorption of nutrients. So weight loss. And it also treats the piles. Those who are suffering from piles, dietary fiber rich food is good. Okay, so these are the health benefits of dietary fibers against cancer, specific kind of cancer, that is colon cancer. Next, coming to insulin resistance, like type 2 diabetes, insulin resistance, and its relation to cancer. Okay. So first, if you have a high calorie intake, too much of calorie intake or too much of sweet intake, okay, it will lead to obesity related insulin resistance. What is insulin resistance? When your blood glucose levels are quite high, you are having too much of sweet food. Okay, your blood glucose levels are too high. So your pancreas will try to keep up with that. Okay, the pancreas will try to secrete more and more insulin into the bloodstream. Okay, but what happens is that after a point, the cells will not allow more insulin to enter and reduce the blood glucose. The cells will just shut the insulin out. Okay, the insulin is not able to enter the cell to reduce the blood glucose levels. Okay, so that is insulin resistance. Your cells will start resisting your insulin that has been secreted by the pancreas. That is insulin resistance. So what happens is that hyperglycemia will happen. Hyperglycemia means too much of glucose in your blood, and that will lead to with increase in age as well as etc. That will lead to abnormal cytokines secretion. Abnormal cytokine secretion means too much of phagocytosis, cells that engulf the bacteria and virus etc. That is and also that mediates the histamines etc. That is released too much in number. Okay, and that could lead to, when these cytokines are too much in your blood, okay, your what your cells will do, healthy cells will do to keep up with the high levels of cytokines. Since there is too much of like terrorism going on in your entire body, there is too much of fighting going on inside the body. Since there is too high levels of cytokines, more cells are made in your body. Okay, cells will start to proliferate at a higher degree, and that leads to tumor and cancer. Okay, and also insulinemia means too much of insulin in your blood. That will also lead to increased cell proliferation. Cancer is basically increased cell proliferation. Okay, what is tumor? Too much of cells that has accumulated and differentiated in a specific area of your body. Okay, that is tumor, and that tumor can turn into cancer if it spreads from one part to another part. That is cancer. Okay, tumors will just stay in one part of the body. Cancer spreads throughout the organs, throughout the systems. So this is how type 2 diabetes, okay, inflammation, type 2 diabetes have its link towards cancer. Is it clear to all, this pathophysiology? How diabetes and yeah, that is growth factors. Okay, no need to memorize that. That is insulin related growth factors, insulin like growth factors. No need to memorize that. Insulin growth factors. So high intake of calorie will make you obese. When you go into the overweight obese category, your body is in an insulin resistance phase. And when your body goes into an insulin resistant phase, that's when too much of inflammation and your risk of diabetes increases. Okay. And once you are diabetic, and once you are suffering from a chronic inflammatory disease, see, from here, from insulin resistance, it can go either way. You can either have type 2 diabetes, or you can either insulin resistance can lead to some chronic inflammatory diseases. Okay, so these two, inflammatory diseases and diabetes, have direct correlation of getting cancer. Because why? Too much of cell proliferation is taking place in both the cases. Okay, yes, obesity and uncontrolled diabetes can be a factor for cancer. ROS is all medical terminologies that is not required here. Okay, ROS stands for reactive oxygen species, etc. That is not required here. Okay, you just take consideration that with increased age, okay, insulin resistance, but also with increased age, okay, both these factors will play will play a key role in increasing your cell proliferation. Cell proliferation means division of cell at an alarming rate.